Everyone. 7:30, so I'll start the webinar tonight. I appreciate everyone that's on this webinar. I'll try to keep it short and sweet because I know that you all have kiddos and lives to kind of live. And so we'll kind of get started. Um, my name is Philip Osborne, Dr. Philip Osborne. I'm a dentist in Mooresville, North Carolina. And I want to do a webinar for new or seasoned parents on making sure the kids have healthy teeth. I've had a lot of parents that come in that, get frustrated with things that are found or things that are not found, that kind of want to take matters into their own hands on preventative care, on kind of want to go some things and some tips and tricks that you can do at home to make sure your kids have healthy teeth. So what I want you to leave here learning is, why should your kid have healthy teeth? As a parent, what should you look out for? What can you do as a parent? And then specifically, when you're taking your kid to the dentist, what are they doing to help? So why should your kids have healthy teeth at all? So one of the main reasons is looks. We have teeth to smile with. Anytime that you can smile, you're always going to be happier. You're going to live longer. Kids are no different. It also is a good self-esteem for them when they're making friends, when they're at school, when they have healthy looking teeth. So we want to help them with that. Most common thing we see in our office, most common thing that we want to avoid for kids is to avoid pain and infection. Kids have smaller outer portions of their teeth compared to adults. So when they get cavities or they get problems with their teeth, it generally happens quicker for them. And so we want to try to catch those things before they become problems where they're taking off school and you're having to take off work to help them out with those. One of the other reasons we have teeth is to eat with. And so the ability to eat, awesome. That's one of my favorite things to do. I want my kids to be able to eat well, to have them grow and enjoy life. And so having good, healthy teeth helps with that. Some not common things that are thought of is fear of the dentist. So we know that it's not going to be much fun for kids when they're constantly being brought in for problems. So they're not going to love the dental office. They're going to hate coming in. It's going to feel like a chore for them. But when they have healthy teeth, we have a blast. We have fun. They get toys and prizes and whatnot. If they have healthy teeth, we can avoid them having crooked teeth and braces. And then another common thing is if we have problems with your baby teeth, you can develop problems with your baby teeth underneath or your adult teeth underneath. So damage to baby teeth can lead to damage to adult teeth. So we want to avoid that. So what should you look out for before teeth as a parent? So when you have a kid and they're yelling at you or finding their voice, what are some things you can look at on their mouth? So that top left picture there is the top of a baby's mouth. Some common things you'll see is that it's just very wide, very flat. You will have a piece of tissue that kind of connects the lip to the mouth there. That can be overgrown on top of the top of the mouth there, their jaw. That's totally normal. A lot of times that can be grown out of that. And there's times where it's a restriction that can lead to a tie. I'll kind of mention that down the road. But just knowing that it's flat, it's really fat looking, it can be really red. That's totally normal. Bottom left is the bottom jaw. So that one's going to be common to say, same thing, very flat jaw. And then right where the tongue is can have tissue that kind of spills over and look like it's swollen. Again, that's normal features for an infant or baby. What's kind of not normal or uncommon, but not abnormal, is to have teeth when they're born. Like you see in that top right picture. If they do, sometimes that can lead to ulcerations in their tissue, their tongue. That just needs to be smoothed away, preferably by a dentist or someone trained to kind of smooth those teeth. And then sometimes you'll have little white or yellow kind of balls kind of scattered on their top of their jaw or on their hard palate, top of their mouth. Those are again a uncommon thing to see, but sometimes just residual tissue from them growing that will go away. That's not infection or anything like that. So once teeth come in, what should you be looking for? This is a good kind of image to take a picture of. There's a general reference of when teeth come in. For the most part, with pediatric dentists and general dentists, what we look for is the pattern is more important than the timing. What I mean by that is it doesn't matter to me that the front teeth on the top come in at 9 months and the other ones come in at 11, 12 months. It's really more, we want the proper order. So front to back, most likely. Anytime that we get teeth that skip around, you could be missing some, or there may be an issue with it where it's positioned in a bad spot. So those are things that we look out for at cleanings and exams and such. But take a picture of that. That's kind of a good reference of when you should expect certain teeth to come in, and also expect teething, which is its own problem too sometimes. What else can you look for when you're taking a look in their mouth? Some cavities. So cavities, like I said, on baby teeth, they have less of the outer surface of their teeth. So holes start to form a lot quicker. And those can lead to infection, lead to problems. So anytime that you look in their mouth and you're kind of looking for any stain that's occurring on them, that's not normal on a kid. And then also on that picture to the left, holes in the front of their teeth, kind of common with baby bottles, when you're drinking lots of milk, sodas, energy drinks, juices, anything that's sitting on their teeth before they get that cleaning before bed. Those are what they commonly look like. Those need to be taken care of, for looks and to avoid pain. You can also take a look at the teeth. There's going to be plaque on the teeth. Kids can get plaque as well. So if they're not flossing, they're not brushing regularly, if they're mouth breathers, they can commonly get stuff stuck on their teeth. That leads to bad gums. That leads to not fun cleanings. So again, kind of helping out with their experiences with the dentist of spotting those things, and kind of coaching them, and we'll teach them at the office how to do it. But also as a parent, kind of looking out for that type of stuff. So I'd say this is probably the most important thing you can do as a parent, is be a good teacher for them, and demonstrate the good habits. So kids pick up on things that you do, whether it's things you don't want them to pick up on, or things primarily that you do want them to do. They love interacting with their parents. And so make this an activity for the family. So how you'll do that is demonstrating, so showing them brushing twice a day, flossing once a day, trying to make it a team effort. And as it shows on that right side there, um, kids are not really held responsible for like brushing their own teeth till they're about 7 or 8 years old. So kind of the good determination for when you can kind of leave them on their own is if they can start to write in cursive, they've got the dexterity to be able to brush their teeth really well. Otherwise, helping them out, give them a little bit of independence, but also kind of let them know mom and dad need to turn as well, to kind of help finish and brush out. So what you can do before teeth come in, is anytime you're feeding, take like a wipe or a towelette and just wipe the gums away. That kind of helps keep the tissue clean. Same with the tongue, helps with breath, but it's mostly just keeping the mouth as clean as you possibly can. That's a picture of my son. So anytime they're finding their voice, like my kiddo there, that's a good time to take a look inside to see if you see anything abnormal, but also give a clean if you need to, if you see any kind of residual milk or whatnot. So when they do have teeth, brushing twice a day, preferably with fluoridated toothpaste. The big picture that I like for if you could take another one would be that middle one of those two toothbrushes. The one on the right is for adults, so we're taught to use a pea size. There is no kids toothpaste. It's all anything that has fluoride in it is all the same as what you would find in adults. So the key is the quantity. So you're going to use a lot less of that. And so we teach the rice, so kind of a grain of rice amount. That will help kind of limit them, swallowing a whole lot of it. That can limit any problems that can occur with them having too much fluoride. You also want to use flavored fluoride toothpaste. I made the mistake of using one that was just mint. That is not something kids tolerate, or they think it's spicy. So use something that's flavored that tastes good, because they will be sucking that down as much as they possibly can. Um, Flossing wise, use something with handles. It's a lot easier to get into their mouth. Yes, you still need to floss even though they've got spaces between their teeth. It's more of monkey see, monkey do. They if they see that, yes, I floss first, then I brush. The more times they see that, the more that will become normal for them. And when they become an adult, less of a chore, less difficult for them to get into a habit of. For parents that are worried about fluoride, which is a totally valid thing, I would still encourage you to have a dialogue with your dental team on why you are. But this is a great toothpaste to use. It's the hydroxyapatite toothpaste. We can go in a whole nother lecture and seminar on that. But that's a good alternative if you're not wanting or feeling safe using a fluoridated toothpaste that helps with kids as well. You at home have done everything you need to. When you take your kid into the dentist, what do we actually do? So the name of the game here with us is prevention. We want to stop problems before they start. Not only do they compound health-wise, the bigger the problem, the bigger the infection, the bigger the pain that they're going to have, but also financially. If you wait on problems when they're small and they get bigger, that's going to be a lot more time for them, for you, and then more money that you'll have to spend to kind of fix those things. Getting established with an office is a great idea. At our office and most pediatric offices, most general dentist offices, kind of what we do is regular cleanings and checkups. The first appointment with us, and for most offices, is just establishing and just letting them know how fun it is to be here, but also meeting the parents and kind of getting the lay of the land on where they stand with their dental health, because they're the ones that are going to be teaching the kids too. So we also take radiographs if needed. There isn't a certain age that we do that at. It's mostly by need. If there's lots of problems in the mouth that we can't see with our eyes, those black and white pictures kind of help us see everything that our eyes can't see that's going on. Um, we also can place fluoride varnish on teeth. Fluoride varnish is probably one of the best things that you can do for your kiddo. Same with fluoridated toothpaste. They just help make it harder to form cavities, to form problems with the things that they're eating, makes their teeth stronger. This isn't something they need to do very frequently. It's usually every 6 months to get that painted on their teeth to make them less likely to have problems. Very similar to our last thing, which is sealants. So this is another very, very great thing that can be done. Seeing the picture on the left, chewing and eating the things. As a parent, you're going to do the best you can brushing your teeth, but you're going to miss stuff sometimes on your own teeth and on theirs. So the picture on the right, essentially what we do is place some liquid on their teeth and it hardens, makes it nice and smooth, harder to form cavities when you have that picture on the right versus the image on the left. Eventually those sealants break off as their dexterity gets better, but we want them on there as long as we can to avoid problems. In conclusion, find a dental home for your children. Um, you know, Contact our office if you've got any questions about anything, regarding your kids' dental care. Um, I appreciate everyone being here tonight, and taking the time out of their day, and I won't take up too much more of your time, but there are some questions that I wanted to kind of go through that have been left in the chat. That somebody had asked. If I think my kid may need braces, when do we start looking at that, or how do we know when it's time for braces? And that's a great question. I'm not an orthodontist, but I do braces, clear aligners for kids. But there is the time that we start the earliest would be about 6 or 7 years old. The main reason why for that is maturity for a kid, the tolerance for what they can do. But also they've got usually their first big teeth in the back, and sometimes their front teeth, permanent teeth in the front that we can use to kind of anchor and move things around. And that helps them out a lot for that. But I'd say 6 to 7 years old is kind of the stage one. And then 11 to 12, somewhere in that range, as they kind of lose almost all of their baby teeth and have a lot more of their permanent teeth, but their jaw still can be moved without having to do surgeries. Another question we got is, at what point should I start looking into interventions for tongue ties? That's another great question, and probably another one we can do a webinar or a video series for. Tongue ties, um, can be a sticky situation to talk about with people, but in general, for tongue ties, you really only want to get that addressed if there's an actual medical concern or like a symptom involved. You can have tongue ties as an infant, as a child, as an adult. For infants, some common things to look out for would be breastfeeding issues, bottle feeding issues, if they develop colic, excessive gas. So, mom's making comments saying, my kid, toots like a grown man. That's not normal. Any weight gain problems that can occur. Those are things that need to be looked at by either a dentist or an ear, nose, and throat doctor. Some pediatricians can do that too. When they're children, the common symptom, the thing to look out for would be speech, and then maybe pickiness of the things that they eat, so their diet. Um, and then adults, neck, back tension, headaches. Most common is sleep disordered breathing, sleep apnea, grinding, clenching, jaw soreness. It doesn't affect just infants and children, it can affect adults too. But it is something that helps out a whole lot. I don't know if that answered their question at one point. So I would say, really, it's just if there's symptoms involved with a tongue tie and like a medical concern. Otherwise, some grow out of it, and generally, when you start to get braces, if they need it, that's something that can be kind of a minor thing that can be coached through either speech therapy or at a dental office. All right, well, that's all the questions that we've got. So again, thanks everyone for tuning into this. We'll be posting more information about this, and I hope everyone is have a great rest of your night. Cheers.